It's the Simmons Bank Celebration List. Visit Simmons Bank in Cleveland at the corner of Keith Street and Stewart Road. Call Ken Dew, 423-381-3427.
Our longtime friend, Dr. Ed McIntyre, joins us, Tennessee Valley Urology. Doc, how are you doing?
Good morning, Steve. Great.
Well, great. And I just want to dive right in here because this is such an important month. We've got a lot of guys listening this morning, and we got a lot of wives or daughters and whatever who care about men. This is Prostate Cancer Awareness Month.
Yeah.
And I know this is something you guys deal with every day. Just at the outset here, tell me about that.
Yeah, so, prostate cancer awareness, should we be aware? Throw out a couple of statistics. So prostate cancer is the second leading cause of death in men from cancer. If you look, about 1 out of every 8 guys are going to be diagnosed with prostate cancer at some point in their life. That's a staggering statistic. Wow. On the flip side of that, only 10% of those guys that are diagnosed are going to die of prostate cancer. Our job is to find that 10%. Who needs aggressive treatment? And it all comes back to screening. That's where you're going to have the biggest impact and where we need to continue to do better. So I'm happy to be here to kind of wave that flag a little bit.
It's interesting, and I'd say interesting timing. I was reading a story this morning in the New York Times about this, and I'm sure it has to do with this month, but basically saying that the cases of prostate cancer are going up because screenings are falling. This is a national statistic. What do you make of that?
There was some data a few years back from a government agency that said maybe we don't need to be as aggressive with prostate cancer screening. Well, the statistics now bear out that was a mistake. So who should be screened? How do we do it? And that's important too, because there's some new data that shows maybe not everybody needs an exam. That's what people are scared of, right? And with a lab test, a simple blood test called PSA, prostate-specific antigen, that's the way that you screen. Who should be screened? If you're a male and you're age 45 to 50, that's when you should start. If you're African American or you have a strong family history of prostate cancer or strong family history of breast, ovarian, uterine cancer on the female side, then you should start earlier, about age 40. And then get that lab test annually. In some guys, you don't even need it annually. Maybe every 2 years is fine if you've got a low PSA at the outset. But it's important just to establish that baseline, and then your physician can interpret that and be able to follow that in the future for you. It's an easy test to do.
It really is. We're joined by Dr. Ed McIntyre, Tennessee Valley Urology. It is Prostate Cancer Awareness Month. Isn't it true, statistics, men are slower to go get checked out by a doctor?
Oh, my gosh. Definitely. They're not as smart. I mean, it's just...
Totally agree.
It's obvious. It's not fear. It's intelligence. No, it's true. I'm guilty of it myself. But we need to throw that thinking out the window. It's simple. It's easy to do. Just get it done. It gives you good peace of mind. And if there's a problem there, catch it early where it can be treated and dealt with adequately.
That's the thing. This is one of those scenarios where if you catch it early, my goodness, it should have a good outcome.
Absolutely. Part of really a major part of my practice now is dealing with men who have advanced prostate cancer that is outside of the prostate. And while we've made huge strides in that area and really are having a big impact in survival and quality of life, we don't want to get to that point. If there's a problem there, we want to address it early where it's easily treatable. And there's lots of ways that we treat prostate cancer.
Now let's talk about that. How do you do it?
Yeah. So, when you look at basic curative forms, there's surgical removal of the prostate, which now is done laparoscopically. We do the surgery in the morning. Patients are home in the afternoon. We do it with the benefit of a robot. It makes recovery super easy. We use no narcotics afterwards. Pain medicine is Tylenol and other things. So much easier surgery than what it used to be. There's different forms of radiation. There's focal therapy called HIFU and some other things that we do. So lots of varieties of ways. It's not a one size fits all. Very tailored to the patient and their disease.
We're joined by Dr. Ed McIntyre, Tennessee Valley Urology Center. All right, let's talk about the PSA scale. So Just tell me about that.
Yeah, so, that test normal is from 0 to 4. Now, the establishment of that was multiple years back, and so more frequently now we use what's called age-adjusted ranges. Men in their 50s, 0 to 2.5, 60s, 0 to 3.5, 70s, 0 to 4.5 to 6.5. Because we know in most guys, as you get older, the prostate grows, more PSA is produced. Because PSA is produced by both benign prostate cells, non-cancerous cells, and cancerous cells. That's how the test works, is cancerous cells produce more of that protein, which is what PSA is. But that age-adjusted range is very important.
And then what can men do to maybe avoid to help prostate health?
I get those questions all the time. An easy way to think of that: diet and exercise. Think of your heart. What's good for your heart? A heart-healthy diet, diets that are high in fruits, vegetables, fiber, low in animal fat. It's a heart-healthy diet. It's a prostate-healthy diet.
All right, my buddy, Dr. Ed McIntyre. Hey, while you're here, let's switch topics just for a second.
Sure.
Can you do that? I know you can. By the way, Ed and I serve on the ATS the Bridge.
What a great night Friday night.
Oh, it was unbelievable. Ed also, the former backup quarterback at the University of Arkansas. You know I got to mention that.
Back
No,
up.
come on. Actually, he was Frank Broyles' starting quarterback, ladies and gentlemen. Won several national titles. All right, here we go. Imagine if you had NIL back then.
Lies.
All right, so the big concert is a week from Friday. Is that right?
Yeah, definitely. Friday, September 12th at the Old Woolen Mill. Luke Bulla, Michael Pruitt, and Crunchgrass Supreme. One of my loves is music, a lot of bluegrass music, but Americana. This is going to be a great show. $25 at the door. Doors open at 6 o'clock. Show starts at 7. It's going to be a great night.
All right, it's at the again at the Weaver Room. Is that right?
That's correct. At the Old Woolen Mill. Great venue.
It's a wonderful venue. Very underrated. Mermaid Mattress, thank you. Taylor Animal Hospital, Tennessee Valley Urology Center. Also, Realty One Group, our friends Dustin and Melissa Sherlin. Ian Harper. Ian did something nice for somebody. I can't believe it. And then,
believe it or not,
some low-power nothing station, Mix 104 Point, as my daughter Reagan used to call it. Anyway, Doc, great to see you. It's so important. Thank you very much.
Steve, Bridget, thank you guys very much.
We got a very nice text message here for Dr. McIntyre. This says, I'm so thankful for Dr. McIntyre and Dr. Ivy at Tennessee Valley Urology for saving my husband's life and catching his prostate cancer early. That's from Adelia Hall.
Wow.
Yeah.
So nice.
You got a lot of people
Thanks,
feel that
Adelia.
way. By the way, let me also point out back to the concert, it's a BYOB. For Bridget, that's every day that ends in Y. So